I'm Dr. Muhammad Adhanizam Buyong. I am the obstetrician and gynecologist of 𝘼𝙨𝙠 𝙔𝙤𝙪𝙧 Hospital. I've been with the hospital for almost 11 years now. There's two parts of this question that need to be addressed clearly. The first part is, are pregnant women at higher risk of getting the infection? The answer is no. The risk of pregnant women to get the infection by COVID-19 virus are the same with the general population. Risk of getting infected depends on how the mother take care of her personal hygiene, how she wear her mask, follow the 3W, which is wash hands, wear mask, and warn people, and avoiding the 3C, crowded space, confined space, and close conversation. The answer for this question is yes. Once the pregnant mother got infected with the COVID-19 virus, they will be classified as a vulnerable group. This means that they will be at a higher risk of getting worse into category 4 and 5. Many studies has been done to show that pregnant mothers who are infected with this COVID-19, they are faster to deteriorate to category 4 and 5. They are at higher risk of getting admitted in the ICU, intensive care unit. They are at higher risk to be intubated for respiratory failure, and they are also at high risk of death due to worsening of the infection that caused the respiratory failure, which is what we call maternal mortality. At the same time, COVID-19 infection also had a direct effect onto the pregnancy itself by causing miscarriages, preterm delivery, pregnancy and hypertension, what we know as preeclampsia, and also a thromboembolic event, which is deep vein thrombosis and pulmonary embolism. So the answer for this question is, it is not necessarily. The mode of delivery depends on two factors. The first one is the month or the weeks of the pregnant mother, and number two is the clinical condition of the mother herself. If the mother is positive but she is well clinically, she needs to be isolated and to be taken care of in the ward. If the pregnancy is below 24 weeks, the mother condition is getting worse, then the pregnancy has to be terminated, what we call medical termination of pregnancy, or short form is MTP. If the pregnancy is above 24 weeks and the mother condition is getting worse but she is still not in labor, then emergency cesarean section will need to be done to deliver the baby. But if the mother is well and she goes into labor on her own and her condition is good, she can give birth via normal delivery. Normal vaginal delivery is indicated, but during the progression of the delivery, she needs to be assisted by forceps or vacuum deliveries, which are recommended to shorten the time of delivery as to assist the mother. If at all the mother have shown any clinical evidence of fetal distress or condition like septic shock, or the condition where the mother shows multi-organ failures, then emergency cesarean section has to be done as soon as possible. The answer for this question is yes, absolutely you can. Mothers who are positive can hold the baby and breastfeed the baby after her delivery. In fact, a close contact such as skin-to-skin contact is allowed, but there is a certain SOP need to be followed. Number one, the guideline says that the mother must wear facial mask. Number two, the mother must wash her hands with soap or sanitizer before holding the baby. Number three is the areas that are in contact with the baby during the skin-to-skin contact during the breastfeeding need to be washed with soap or sanitizer. The place or room, furniture and other equipment that been used during the breastfeeding session need to be washed or sanitized completely. before and after the breastfeeding. And after the breastfeeding, the mother needs to be isolated from the baby, where the baby will be kept in another room and the mother will be isolated in another room. The answer for this question is absolutely yes. COVID-19 vaccines are safe. All types of the vaccine are safe to be given to a pregnant mother. Number one, the vaccine doesn't have any effect on the pregnancy. Number two, the vaccine has no effect on the baby inside the womb. In fact, vaccination of pregnant mother is so vital and so crucial that all women who are confirmed pregnant should be given the earliest appointment for vaccination. The recommended timing for vaccination by the World Health Organization is between 14 weeks until 34 weeks of pregnancy.